Okay, so it is Cinco de Mayo, and we are talking about pain. And that could come from too much tequila. But happy Cinco de Mayo. This is my Mexican sombrero that I got in Mexico City. Weighs about 2 pounds, and it is very glittery and gorgeous. And I always like to wear it. I'll probably wear it out tonight when I go out. So we are talking today about pain. And Janet just had an excellent question. Every once in a blue moon, I get somebody who takes the CBD and it erupts, like it gives them a headache or a hot flash, or in her case, she's got a lot of toxicity and pain in her feet. And when she put the balm on it and soaked her feet with CBD, it actually made everything worse, and everything kind of like exploded and got more painful, headaches, didn't feel good, flu-like symptoms. And that is an indication that her endocannabinoid system isn't working. And if that system isn't working, it can't take the CBD in, this molecule, this vitamin that's so vital. And so what happens is it throws it back out into the bloodstream, and you get these reactions. And for her, and this is extremely unusual, but for her, it lasted a couple of days. And then she tried the balm, a topical on her feet the next time. Same thing, not as bad, but the same thing. So in that case, in her case, we know her endocannabinoid system isn't working. And so we've got to jumpstart it very slowly. And so even a topical, putting a cream on her skin was too much CBD. So we're going to have to dilute that and start putting a diluted amount on her skin. And then she'll get to the point where she can take a drop of a really basic CBD and put it in her mouth, or put it in a glass of water, most likely. So how we usually jumpstart this endocannabinoid system is we actually give the body just a teeny bit of CBD and allow that to get through the body. And when we do that, our receptors, her receptors, will start to grow and will waken up, or jumpstart whatever she's got in her system. It takes about a week to 2 weeks, and sometimes even 2 months, depending on how dormant or dysfunctional that endocannabinoid system is. Everybody has an endocannabinoid system, but sometimes if it's deficient, if we've got a disease state, most likely it's not working very well as well, okay? So I'm going to go over pain and what the heck is pain. And pain is very different with everybody. But I'm going to look at this, my spine here. I'm going to take out my spine. If you look at this, if you look at the spine, we've got, this is the front of our body. So this is the front, okay? This is the front. This is the back. All of these, we've got all these bony protuberances, okay, called spinous processes. All of these bones in the back, all these little bones help protect the bones, okay, and help protect the spine. And also what happens is all of these bones have not only nerves, see this red part, we've got nerves coming out of every vertebra. So if you see, that's your disc, the little spongy stuff, and see this red thing right here? That's actually a bulging disc. And if you look at it, the disc itself, that squishy part, is coming out. Well, the problem is there's a nerve that's going to come out here and come all the way down the leg. So if we have leg pain, for instance, if we've got pain in the thigh or the knee or even the foot, it always starts from the nerve that's coming out of the back of the spine. So your L3-4, right down by, right where the top of your, say, about an inch past your butt crack, that's like your L4-5 area. That's where the nerves come out and go down the leg. So if you have foot pain or leg pain, you're going to want to put the balm or your cream, your CBD cream, on your foot, but you're also going to want to put it on the back right here where the nerve starts. And that's the same thing with a migraine. So this is the top of the spine, the top of the cranium right here. The nerve comes out of the neck and it goes right up this, right past the ear to the back of the eye. That's called the ocular. That's called the trigeminal nerve. Okay, starts from here, goes back up here and right behind the ear, and then right to the eye, and then all across the temporal. So if you have migraine pain, you're going to put your cream or your CBD oil right where it hurts, but then you're going to go to the bottom of the hairline and put your cream right there. Okay, and then all the way up that trigeminal nerve behind the ear, all the way to where the pain is. Okay, does that make sense? So these are called dermatomes. In orthopedics, neurosurgery, we know that the nerves radiate out. And so if you are having pain in your arms, if you're having problems with even your shoulder, your elbow or your shoulder, remember the nerve starts at the back of the neck there. So that's why we have chiropractic as well, because if that nerve, if that spinal cord is out a little bit, or that the bones are a little bit juxtaposition in the wrong position, so it's not nice and neat, then you're going to affect the nerve. When you affect the nerve, then you affect the blood supply. When you affect the blood supply, then you don't get oxygen and food to the tissue. And that's why with chemotherapy patients, we get a lot of peripheral neuropathy, a lot of burning and numbness in the fingers, because the chemo is so toxic that for some reason the toxins tend to come to the end of the fingers and the blood vessels start to degrade. And so that's why we really gotta soak our hands when we have chemo-induced peripheral neuropathy or pain in our fingers. If you ever have pain in your fingers, start doing an Epsom salt bath or a CBD Epsom salt bath, and the pores are the largest in the fingers, in the hands, and the feet. So if you want to get toxins out of your body, soak your hands or soak your feet for at least 30 minutes, okay? So all kinds of pain. So if you have, say, for instance, back pain, and it hurts in the back, then you put your cream on the back where it hurts. But if it's radiating down the leg, then you want to put it where it's radiating. But remember, put it in the back too, because that's where the spine, that's where the nerve starts, and it goes all the way down the leg, okay? All throughout your body, you've got nerves that start from the spinal cord, okay? So very, very interesting also. I had an L4-5 disc herniation. So that's actually that's a 5-1, that's 4-5. So the 5-1 is, the 4-5 is right there, right where that red spot is. That's where my disc herniation is. So you would think I would have low back pain. Well, my pain radiated all the way up here to my bra line. So you can see here, the nerve comes out here, but my pain's way up here. There's no nerve that goes up that way. So pain moves in the body all over the place. A lot of times it moves to where you're stressed, and other times we don't know why. It just moves all over the body. I was even getting wrist pain from my lumbar herniation. Go figure. Chiropractic always helps, and I like network chiropractic. I like a chiropractor that's gentle and that's moving the muscles as well as the bones, because if you're just moving the bones, it's very hard for the muscles to follow, okay? Okay, so we covered that. We have different nerves all over the body. Some start at most of them all start at the cervical spine area, okay? Okay, so the next kind of pain for women, especially, we get a lot of pelvic pain after birth, post-menopausal, um, even after intercourse. And some of this pain is due to the muscles being juxtapositioned after birth. Some of it is just because we sit too much, and some of it is because we exercise too much. But the CBD actually helps that pain. I've had 4 or 5 women with pelvic pain, really tough to help. There's specific physical therapists that do work down in the pelvic region, but it's difficult to get to, and it's difficult to change the musculature, the ligaments, and everything else. And I'll show you again, you know, when we look at the spine, you've got all of these nerves coming off, but every single bony protuberance, there's a tendon or a ligament or some sort of connecting a portion and even muscle that comes from all of these bony protuberances. So you can see we have a ton of muscles, and they're really tight. And when we bother them, it's tough to get them loosened up again. Okay, so pain also not only comes from a physical trauma, but it also comes from emotional trauma. So we can have grief. We can have a childhood trauma that we don't even remember, and it can come out as pain. It could also come out as an autoimmune disease and even cancer. So all of these emotional traumas that we have, ask your parents, ask your mom, you know, anything weird happened when I was a kid? Should I be knowing about? And that could be anything from you fell off the monkey bars and you had to have stitches in your head. And at the time it was like, you know, you never thought about it, but maybe that was an emotional trauma. So it can be something physical. It can be something that somebody said to you, and it could be something that was perceived at the time as a 5-year-old. You perceived it as a trauma and you held it in the body. And so that's why we do energy work, we do chiropractic, we do massage, all of these things that releases stress. Well, what else releases stress? Laughter, singing, dancing, exercise, orgasm, massage. So physical therapy, all of these things can actually release laughing. That's another great release of energy and pent up negative energy. There was one else. Oh, when we hiccup, that's a sign that there's something in the body that's not right, and we're trying to get it out. When we cough, same thing. When we sneeze, same thing. So, so look at the emotional trauma, work through your grief. We have all had loved ones that we've lost, and that grief is a stressor to the body and can be even as painful as a physical trauma. Okay, so we need to look at that as well. Okay, so the second thing we were going to talk about today was arthritis. And many of your doctors will tell you that arthritis is an aging disease. And I'm here to tell you it is not. It absolutely positively is not. Yes, we get arthritis as we get older, but a lot of young people have arthritis. And part of that is because of the foods we're eating, the inflammatory foods. Okay, so some of the inflammatory foods we've gone over before, but sugar is our number 1. Dairy is number 2. What was number 3? Grains. Why do I always forget grains? Grains, any grains, rice, flour, corn, pasta, cookies, bread, all of those grains, yeah, they have gluten, but it's not always the gluten. That's the protein. It's actually the fact that there's no mineral and there's no fiber in the flour that the United States sells today. The FDA has allowed the food industry to strip all of our grains of the healthy part, the minerals and the fiber. So if you wake up one morning and your arthritis is on fire, look at what you ate the night before. It's very telling. If you ate a lot of grains or sugar or had a big cake or something like that and you're on fire the next day, that's an indication you've got to get those things out of your body. When we start to lessen the amount of inflammation that comes into the body, we can go back to eating grains. I eat probably pasta or bread once a week. And it's usually chips. It's usually corn chips that kill me. And most likely it's the GMO in the corn chips. Every single corn item that you find in the United States is GMO. I'm sorry, they say it's non-GMO. There's no way. They have found GMO in every single population all around the world. These GMOs from Monsanto, they're called glyphosates, they're everywhere. And those herbicides, those pesticides give us pain, give us inflammation, give us neurotoxins. So how do we offset arthritis? Number one is food. Number two is move that joint. So you've got bumps on your joints, okay, and they start to hurt. You stop using it. Well, what you need to do is start exercising it. If you're always going like this, then exercise it by going backwards. Push your fingers backwards. Exercise them backwards. This finger I broke. I broke that finger, I don't know, 30 years ago, and about 5 years ago, it started hurting. And you can see I have a huge, you can't see, but I have a huge bump on it. So I'm always going like this, even though it hurts, I'm always trying to get the fluids in there and keep the nerve innervation in there so I don't lose that activity of that finger, because this is my right hand. I'm right-handed. So that's really important. Your joints too. Get out and walk, ice before, ice after, take your CBD before, take your CBD after, but don't let that joint atrophy by not using it. If you can't put any weight on it, then get on your back and move your knees, move your knees. We don't have to go to the gym to get exercise. The best exercise in the world for women especially is walking. Okay, so get out and do your 10 minutes of walking. That's all we need, 10 minutes of walking. Okay. Okay, so where should I apply the CBD cream for migraine? Why is my pain worse some days? Look at what you ate the day before. Yes, of course, if you overdo it in the garden or if you overdo it exercising, you're going to get pain. But food is pretty much our number one problem with inflammation, which is the cause of pain. Okay, and how does the endocannabinoid system fit in here? Well, I've had my first 19 years of my life, I was a swimmer. I was a competitive swimmer. I swam for Cal. Then 15 years later, 12 years after that, I played rugby. And then another 6 years after that, actually now I'm about 15 years into soccer. So needless to say, I have a ton of inflammation. So whenever I go and play soccer, I take my CBD capsule before, because I know that's going to last longer. And then I take the tincture under my tongue, because I know that's going to help defer the inflammation immediately. So a tincture under the tongue gets the CBD into the bloodstream immediately. Okay. If you're going to play soccer like I do and you need it to last for 2 hours, then I'll take a capsule, because in about 45 minutes, that capsule will be at its highest potency, and I'll have a lot longer CBD time in my body. And what that's doing is it's keeping the inflammation down, as I'm exercising. When you keep the inflammation down as you're exercising, you're not going to get as sore. You're not going to get you won't have as much pain, and you'll keep the inflammation down, so your recovery will be quicker and better, and you can exercise more. So it's the same thing when you go to the dentist, right? Hate it when they scrape your teeth. I always take my tincture and I put it under my tongue, but then I also put it right on the gums. Right on the gums, you're getting your pain reliever right into the nerves where they're working, where they're scraping. The tooth has a nerve, and that's what's really uncomfortable. Ever since I've been using CBD with my dentist appointment, I no longer need to stop them mid through and say, okay, I need a break. I don't need a break. They go the whole, whatever it is, 10 minutes of scraping, and I'm good. I don't have to stop them. So that's awesome. All right. All right. So just know, again, in the evening, in the sleep time, which is from 10 p.m. to about 2 a.m., 3 a.m., that time is the most important part of our sleep, where our body is recovering. And that's also, while we're sleeping, our immune system jumps into gear. So if you've got pain and your immune system is in charge of inflammation, that immune system is going to be attacking the pain while you're sleeping. So really important, if you have a neck pain and you wake up in the middle of the night with neck pain, make sure you have your CBD cream on your neck before you go to sleep. Keep the inflammation at bay so the immune system can work on healing and not always trying to fight the inflammation. Okay? All right. Let's see. What are the top? We went through the top inflammatory foods. Some of the strategies that you can implement if you're trying to reset your metabolism and reset some of this pain. Like if you've got arthritis or an autoimmune disease, you want to reset the body. And how you reset the body is intermittent fasting. What the heck is that? It means that, if you're not hungry in the morning, don't eat breakfast. If you're one of those people that have to eat every 2 to 3 hours, you have something called insulin resistance. That is affecting your pain. So if you want to reset your metabolism, reset this insulin resistance, if we're addicted to sugar, which most likely means that you've got a lot of pain, because sugar directly turns into carbohydrates, turns into inflammation. And we know that cancer follows inflammation. We know that COVID and any virus feeds off of sugar, okay? Sugar is literally the #1 evil in our life. And when you look at pasta sauce, there's sugar in the pasta sauce. I mean, that's counterintuitive. The Italians are like rolling in their graves going, look at those dumb Americans. They're adding sugar to their pasta sauce instead of onions and garlic and basil. Okay, so look at the sugar. So intermittent fasting. Intermittent fasting means that you go out without eating for 16 hours, and then you eat in an 8-hour period. That's pretty easy, okay? You have dinner at 7 p.m., 7 a.m. is 12 hours, another 4 hours is 11 o'clock, okay? So 11 a.m. you can eat, breakfast. Again, that's 16 hours. That's not hard. But what's hard is when you get to 20 hours of not eating and then 4-hour window. When you do that once a week, or maybe twice a week, work up to once a week, and then maybe on the 4th week, do it twice a week, you're going to start to reset your metabolism. Whether you're trying to lose weight, whether you're trying to get out of pain, this is excellent, because what happens when you intermittent fast like this, the body says, hey, where's the food? Oh no, and starts to hunker down, and it makes everything really efficient. So we have little Pac-Man, all the neurotoxins and the inflammation gets eaten up. That's great. We start to detox. That's exactly what we want. We want to detox. And then all of your systems start to get a little bit more efficient. Your metabolism will get a little bit more efficient. So when you start to eat, when you get out of an intermittent fast, you want to eat fats and protein. You don't want to eat like an apple. You don't want to eat a bunch of sugar. So again, the fats that are healthiest are the olive oils, the omega-3 fats like avocados, nuts, eggs, salmon, herring, anchovies, all the smallmouth fish. Omega-3s you can actually even take on my website through Designs for Health under supplements, fish oil supplements. The best fish oil supplements are those that are molecularly distilled, which means that they've been tested to not have mercury. All the fish in the sea have mercury. So you want wild caught salmon if you're going to eat salmon, okay? The mackerel, the anchovies, the sardines, they're high on the water. The heavy metals sink. So we don't have to worry about those little fish, but we do with the salmon. So you want wild caught Alaskan salmon, okay? Not the farmed stuff. The farm stuff, even though they'll put a little screen in the ocean and the salmon are still in the ocean, but they're feeding the salmon bad stuff, okay? So no farmed anything. When I do farmed salmon, I get joint pain, a lot of joint pain the next day, okay? So put your questions in the chat if anybody's got questions. Let's see, how does, let's see. Any other questions? Arthritis, migraine, pelvic pain, back pain. Okay, we went over chemo-induced pain. I think that's it. I think we covered everything. Does anybody have a question or an area of pain that I didn't get into? Again, if you have foot pain or numbness, when you have pain, that means that the muscles or the nerves and wherever that pain is are kind of on fire. So do your Epsom salt baths, okay? If you're trying to detox, an Epsom salt bath with putting the hands in or putting the feet in or putting your whole body in, if you've got something like fibromyalgia, I've had really good results with patients who have RA, osteoarthritis, rheumatoid arthritis, and even regular old arthritis. Those types of pain, you need CBD in the bloodstream 24/7. So that's either a tincture or a capsule. I've got these beautiful omega-3. That's the good oil you want. That's the good fats, turmeric and CBD. So we have those as well. So you can take a capsule or a tincture twice a day to keep the CBD in your body 24/7. Keep that anti-inflammatory going all during the day and all during the night, okay? So usually in the morning, I'll do a tincture. If I'm gonna go play soccer, I'll do a capsule as well. And then when I get home, I'll do some more tincture. So I like the tincture just because I know one squirt is 1 milligram. And then if I know, for me, I take about 8 to 10 milligrams twice a day. So I can take a gummy, or I don't have my gummies here, but I've got very nice flavor gummies, very sweet. They're only 2 milligrams of sugar. There's no corn syrup. There's no high fructose corn syrup in my gummies, and they're only CBD. Everybody thinks gummies are something where gummies are something where we get high. My gummies are for pain. They are for anxiety. They only have CBD in them, okay? All right, are there any other questions?
Yeah, I have a.
Oops, sorry. Okay, go ahead, Dee. I'm sorry.
What if you're too skinny and you want to gain weight? Intermittent fasting is not a good idea for me.
That's
I
right.
struggle to keep my weight up now.
That's right. Okay. So in that case, if you are struggling, CBD can actually help you with weight gain only because it helps balance the metabolism. So that's a good question. For you, for anybody, it still goes back to eating the healthy things, which are the omega-3s. And then, I hate to say it, everybody thinks that grains fill them up, but grains really create a lot of inflammation. So the things that are going to, so I'm gonna unmute you for a second, Dee, and then I'm gonna ask you, how do you do with nuts or salmon?
I have a lot of stomach issues, so so I don't eat a lot of. I try to stay more to soft foods, but I eat a pretty healthy diet anyway.
Okay.
I eat vegetables and
Okay.
variety.
So what it sounds like is that we have to heal the gut first. I'm not the greatest nutritionist of the world, but when we have to heal the gut, bone broth is excellent, probiotics and prebiotics, and then sometimes the vegetables are too fibrous for you to actually digest, and so it might do well if you could juice with a very specific juicer that doesn't break down the cell wall, but also if you can saute your vegetables so they're a little bit more digested than what your body needs to do. Because if you're doing how are you with raw vegetables?
I don't eat them because of that.
Okay, because of that. Okay, so you need a program where we've got to heal the gut. Okay, and that is definitely another Zoom call. But if you call me tomorrow, you know my number. I'll get you on the right path. Okay, because we got to heal the gut. CBD really helps to close up the fissures when you've got leaky gut. When you can't digest, it means you've got something called leaky gut, and there's little holes or fissures all the way down the digestive tract.
Right.
And if there's leaky fissures all the way down the digestive tract, then you're not only going to not absorb that nutrition, but you're losing that nutrition, and that bacteria that's now getting pushed into the bloodstream is now creating more pain. It's a vicious circle. So we've got to heal the gut. CBD will help, absolutely. And I would say, I don't have it, but my CBD oils that say natural, they have no stevia. They're very clean. Those are the kinds of CBD you want, without sugar, without added essential oils or the citrus fruit. So I've just created a new CBD tincture that's very clean, and it has 12 different proprietary anti-inflammatory terpenes, which might be a really good guess for you. So I will help you with that. CBD isn't something that it does help with the cravings, the sugar cravings and the carbohydrate cravings. But sugar and carbohydrates are not what are going to put on the weight for you. Okay. Good proteins, clean proteins, and fats. And I'm talking about omega-3 fats, not omega-6 fats. So what you've got to look for are the omega-6 fats are in everything from vegetable, or omega-6 fats are vegetable oil, canola oil, Wesson. Omega-6 fats are in your whole grain, wheat toast, wheat bread. They're in most salad dressings have vegetable oil. Your nuts that are roasted in canola oil. Horrible. That's horrible. We got to have more omega-3s and less omega-6s. Okay, so let's see. So when the question is, when you resume eating following a fast, you said to focus on fats, and the other one was protein. Yes, When do CBD and traditional medicine complement each other? Great question. CBD always complements everything because it's jump-starting this system in our body that is helping the immune system. So when we look at pain medication, your oxycodones, whatever the pain medication is, when you take CBD at the same time as your pain medication, it actually makes the pain medication stronger, okay? Even if you're on an anti-anxiety, the CBD is not going to affect the anti-anxiety medication, but it's going to help your body ground yourself and focus. So we never see drug-to-drug interactions with a clean CBD, and everything on my website is clean. I make sure. In other words, clean means no pesticides, no aflatoxins, bacteria, mold, etc., and no heavy metals. And this plant, this beautiful plant, pulls toxins out of the soil. So if your CBD isn't third-party tested, those heavy metals could be in your medicine, and we don't want that in our medicine. So great question. CBD goes with all types of traditional medicine. It complements it by creating more pain relief. And of course, you know, when you take CBD, you're always getting an anti-inflammatory in the body. So your immune system is putting out these anti-inflammatory cytokines, no matter what's going on. It could be a virus, it could be cancer, it could be an autoimmune disease, it could be, you know, you cut your arm. The endocannabinoid system is always working when something happens like that, okay? Now, in the case of Janet, her endocannabinoid system isn't working. We know that because the first time she took CBD, she felt headachy and nauseous and had real bad, I guess it was headaches and kind of like, you know, yucky feeling. It went away. It always goes away after it gets out of your system, and usually goes away within about 5 minutes. But if that happens, then we know we got to very slowly bump up your endocannabinoid system and awaken it really slowly. So we always start with a small amount and then bump up slowly in her case. And what in her case, we'll get to the point where we put 1 drop of CBD in an 8-ounce glass, and she'll drink 4 ounces one day, 4 ounces the next day. So that's how it works. Okay, any other questions? I don't see any other questions here. Thank you, ladies, and I will send out the recording. And if you have any other questions, ask greenalley@gmail.com. And my website, as you all know, is greenalley, ALLEYCBD.com. greenalleycbd.com. Thank you so much. Happy Cinco de Mayo. Thanks for coming. Take care.
Thank you.